So with that said, I'm here as long as you guys need me. I'll answer any questions you have, whether it's about this or anything else.
I have really painful Achilles tendons.
Okay.
But when I try to do any of the recommended exercises, they hurt so much that I can't do them.
Right.
So how do I get my ankles stronger without irritating what's already irritating?
Just for clarification, what exercises are they? Someone told you to do that are hurting?
Well, actually, anything that I do that involves those muscles helps a lot, but like ankle raises.
Okay. So yeah, if you have Achilles,
even like the gentlest.
okay. If you have Achilles tendonitis, doing any of this is gonna just wear you out. And so, along with your ice and rest and gentle stretching, what I would suggest is just work on ankle stability, not going up on a toe, but just working on the balance of the ankle. And maybe we can talk a little more in detail after this because I need to ask a few more things. But in general, if you have a really solid tendonitis, then just powering through it. Some people it gets better, it'll get better, but in most cases you're just going to make it worse, and it's going to throw you off the path you're on of losing weight and getting in shape. So I would work more on ankle stability. And then there's also, if you've ever had ankle issues before, your ankle joint probably isn't moving the way it should, and such that you can't loosen the Achilles tendon until that joint is moving. I'll tell you more about that later. Yeah. Okay. You are having side effects? Yeah, we should talk about that after. Yeah. And I'll just say now, if you can't wait around and you do want to talk to me or have specific questions and you can't stay and wait and whatnot and talk to someone after this, I'll just maybe put this over here and I'll contact you in the next few days if you can't get your question answered.
Talk about the abductor or adductor, I don't know which one. So I know there's those two machines in the gym.
Right.
So if you're weak, if your knees go in and you're weak, that means you're weak on the outside.
Yeah.
So you should do the exercise.
Going outside, yes. So external rotation is important. And since you mentioned, this is a little off topic, but she mentioned an exercise in the gym where the legs go out and then you pull the legs in, and that's great. It's fine. It's not a super functional exercise. Also, though, I mean, I gave you the clam. Well, in the clam, you're not on your feet. That's not what I consider functional. But in a group, in a large group where I haven't, talked to any of you or know your issues, having you do rotational weight-bearing things, you might have knee issues or hip issues that wouldn't be safe. That's why I have you doing the clams on your side. But there is, I want to just throw this out there. It's a back exercise machine, and I just can't believe it when I see people working on these, and probably most people in here have. Have you ever sat down on that machine that has the bar here, and then you squeeze forward like that, and you think you're getting a great ab exercise? It's actually terribly dangerous for your back. And also, when you sit down on one of those and you turn against, you're seated and you turn against the weight, both of those create really big shear forces on the discs, and it's created a few disc herniation patients that I've seen through the years. So there's a lot better ways. If you're going to strengthen your abs, you can do all kinds of stuff on your feet or on your back where there's shear forces too. So avoid those types of equipment in the gym. But the one you mentioned, I mean, that's fine and that's good. But there are a lot of ways you can strengthen external rotators and protect the knees. Lunges are great. I like lunges if it's safe for you to do, which I can't say, right now. But just if you're going to do lunges and you're doing it, make sure that you're not going in, like this. Make sure the knees are right over, you're staying stable.
Shoulders.
Okay.
So we do a lot of hill work, and I know that you use your upper body for a lot of hills. Shoulder issues?
Well, one thing I'd say with shoulders, just as a broad-based comment, is that unless it's like a throwing athlete or someone who got hit in the shoulder, I rarely see anyone develop a rotator cuff tendonitis or issue there with good posture. So if your shoulders are back, your head's in line, I never see someone like that come in and it's like, my shoulder just started hurting out of nowhere. You know, I just don't see that. And what happens is that when the shoulders are forward like this, there's a space that the main tendons exit and grab onto the upper arm bone. That space becomes very small when your shoulders are forward. So then if you have a small space and you start to reach and do things, or you know, you're mousing all day or whatever, then you're more likely to impinge or pinch on those tendons. So as a just broad-based general statement, the best thing you can probably do for your shoulders, aside from specifically, you know, finding out certain weaknesses and getting treatment, would be shoulders down and back, head retracted, and just getting in the habit of good posture. Yeah.
So, what is the best exercise for, say, your core or your abs? Because I have a real bad low about it.
Okay.
And I find that I know it has something to do with my abs.
Right.
But when I get on those machines or trying to, I guess, sit-ups or crunches, it kills my lower back.
Hurts your low back. So this is a really common thing that she mentioned. I don't know if you guys heard over there. She said, when I try to do certain abdominal exercises, crunches, sit-ups, different machines, I end up, it really hurts my back. I can't do it. And I hear that all the time. And quite often what's going on in that situation is that part of your back pain is due to your hip flexors. I don't know if you guys do this, but your hip flexors aren't just right in the front of your hips. They actually go up and attach to the front of your spine. The entire lumbar spine, the front of it, has attachments for your hip flexors. So not only do they do this, when they're tight or spasmed or contracted, they pull you into an arch. They pull you into a pelvic toe like this. If you watch my fingers, when that happens, it compresses here, right? And then you add to that the fact that most people who have weak abs are doing their abdominal exercises, they're using their hip flexors more than anything, especially like sit-ups, you know, things like that. So you want to do really small movement controlled exercises that you know you're using just your abdominals and not your hip flexors. I do like crunches. You can rest your feet up on something when you do them and just keep it real slow and simple. Then you're usually going to be able to relax your hip flexors rolling up for that. But also you probably need some stretches for your hip flexors along with that. If you talk to me afterwards, I can teach you a couple of things. Any other questions? Did you? Yes.
I just, we were at the end of our workout just now, and I said I was going to run up the hill, and I heard a pop.
Okay.
And right now it feels like super, super tight. I mean, I walk back, but it's a strain to do what the leg is supposed to do.
So in this situation, so she felt a pop in the back of her calf. By looking at her calf, I can tell she didn't rupture her Achilles because then you feel it, it would like pull up your leg like a blind, you pull like these things. If that ever happens to you, you need to get surgery within the next 2 days, because the longer you wait, the harder it is for them to get the tendon and reattach it. I know it sounds pretty gross, but I just say, because this stuff happens and it's important for you to know that. Don't think, oh, it'll get better, and a week later, then they can't reattach it as well. So, but she didn't have that. She heard a pop. She probably had like a minor partial tear or something like that. And that can be very easy rehab. But initially, you know, ice and getting to see a healthcare professional early on is important so it doesn't spiral out of control. Icing, probably in your case some gentle stretching, but I have to look at it to say for sure that. Feel free to stick around after that. Any other pops or cracks today?
Beyond our baseline, you mean?
What's that?
Maybe beyond my baseline?
Exactly. Yeah. Anything beyond the norm.
Right. Snaps.
Well, if there's no others, and you know, anyone that wants to stay after and talk individually, great. Again, if I'm talking to someone, it might take a few minutes. If you don't want to wait around, just leave your name and number there. We'll get your questions answered. And again, what you're doing is an inspiration. Keep it up. And thank you again for having me.